Hafne, and welcome back to Health, Home, and Lifestyle. I'm here at the Guam Immunization Office with Program Manager Annette Uggan. We're here to talk about the National Immunization Survey. But for those who haven't heard yet, what is this national survey?
Well, the National Immunization Survey is a nationwide coverage assessment done by the U.S. CDC. It actually started in 1994 as a result of a measles outbreak in the mainland. And then through the years, states and territories have been participating in it. And in 2013, Guam was the first U.S. affiliated Pacific Island jurisdiction to pilot it. And so we are now entering into our third year in conducting this annual survey. And it's to look at the coverage rates for children 19 to 35 months of age, excuse me. And then we also look at teens 13 to 17 years of age, just to see how are we doing with our immunization efforts on Guam, to see which vaccines are we reaching, the targets, are we making progress, and then just to see how our different health efforts on Guam, because we do ask also, where do you receive your immunizations from, private or public sector, outreaches, and so that this helps CDC with guiding policy as well as for any grant funding opportunities that the island can receive.
Okay, so I know this survey already began in April. How long is it expected to continue?
Well, the survey is kind of a two-part situation in that the first part, normally for about 2 months, we have the contractors that from NORC at the University of Chicago are calling from off island. So if you do see a long distance call number, that they are the contractors that awarded by CDC to conduct this survey, and they call and they ask for eligible households. It's a random telephone survey, and so they actually have to screen, do you have anyone that is eligible, be it a child that's 19 to 35 months of age or a teen that's 13 to 7 years of age. If they do, then they ask permission to continue with the survey. It takes about 20 minutes, and they're going to ask basic demographic information, the child's name and age. It's strictly confidential. Then they're going to ask a series of questions of where do you receive vaccines at, be it at the private or public setting, and then they'll go through the different questions of the different vaccines for the age appropriate series. So like for the younger child, they'll be asking questions more for like maybe DTaP, and then Hib or hepatitis B. Then there's some vaccines that the teens also receive, similar Hep B, the MMR. Then they'll ask HPV vaccine, or if you receive the tetanus diphtheria booster shot. And so those questions will be asked, and dates and locations. And then they'll ask permission to contact your provider who administers the vaccines to your child, because they want to cross-reference the records. Sometimes different records have more information, so they want to get a complete picture of this child from both the personal record and the private provider or public provider's records. And then they consolidate that, and so that they can determine what is the coverage rate for each vaccine type, and then also as a recommended series for that child or that teen. And so when they do send out a report, everything is de-identified. There's no concern about parents, was my child's information going to be able to be identified? No, they de-identify, and they just do a summary or aggregate report based on vaccine name, the dose, and then the series, and as well as a percentage of coverage. And so everything is strictly kept confidential. It's a US CDC approved study. We're bound by confidentiality in the US Privacy Act, and so that's something that will take maybe 2 months to get the appropriate sampling for calls. Then they have to go and reach out to the providers now and ask them for those records, which will take a few months. Then there's data analysis and data cleaning. And so normally the results don't come out until the following year, usually about July or August. So right now we started for 2016 NAS and NAS teen. We probably will not get the results published by CDC until July or August of 2017.
Okay, so I know they've definitely been active in the community. I've heard some of my friends have received phone calls from off island.
Yes.
And will they actually be asking to speak to the children?
No, they have to actually ask first, is there anyone 17 or older? They need an adult. And then from there, they'll ask a parent or guardian of a child who's in this age group. So if there's no one in that age group in that household, then they'll just thank you, and then they'll just mark them off the list, because they're only looking for households that have those two age groups, because those are the ones that we look for, because usually by age 2, a child should be up to date with recommended vaccines. The next shots are at 4 to 6 years of age, right before they go into school. Then we're looking at the teenagers, because they're around that time. There are some vaccines that are only recommended for preteens or adolescents, and so we want to make sure, have they gotten their booster shots? Are they getting those vaccines that are only appropriate for teens? And so they will not speak to any minor. They will only speak to parents or guardians. And then again, if you do not want to be part of the call, they have their policy or procedure of 3 attempts. So at the first attempt, you know, and you call back, or they return your call and say, you know, would you like to participate, and you refuse, then they will have them removed from the list so that individuals are not bothered again to participate in this survey. But we do ask for participation. It's a very important survey. It helps guides us. It gives us a current population-based coverage rate that we can use to say, you know, wow, this vaccine we're doing pretty well. This other vaccine for this age group, you know, we're below the target goal, and we need to maybe focus our efforts more on that. You know, especially the big push for HPV in recent years. You know, it prevents cancer. You know, that's something that can help guide us, saying, you know, wow, our HPV rates are low. Is it, you know, we're looking at males versus females, and then we look at a total the total aggregate, and so we kind of need to see where do we need to focus our efforts, be it for childhood immunizations or adolescent immunizations.
Okay, so I know you had mentioned that this survey has been going on here in Guam since 2013.
Yes.
So what are the results that you've seen so far? How has this survey helped you guys here in Guam since you participated?
Well, we did see in 2013, we got the results in 2014. There are some individual vaccine antigens that we actually are doing pretty well. We're right up there with the national average. There are a few vaccines that we actually are slightly above. Then there are the vaccines like the HPV. We just recently introduced that as a phased-in approach. We started with females only in the teenage group, and then a few years later we added in the male adolescents. And so those rates we were expecting to be low, and it really was.
So if people want to learn more, find out any more information, is there a number here that they can call?
Yes, they can call our program at 735-7143. They can also go onto the US CDC website. They do have a page there specifically for the National Immunization Survey, and it's the www.cdc.gov/vaccines, and then they can just look for a National Immunization Survey, and it can give them more details. You can see all the different coverage rates across the nation, as well as for the territories that are participating.
All right, thank you so much for joining us. Again, make sure you participate, take the phone call. It's not a scam, and stay tuned. We'll have more health, home, and lifestyle after the break.